I'm Robin Marshall. I'm on the air at K104.7. Very happy to be with you today because I have somebody very special to introduce to you. Dr. David Klein. He's sort of like a magic man. He is the master at making a woman or a man become more enhanced. He will work with a woman or a man and make them to the fullest capacity they can possibly be. Is that fair?
That sounds reasonable.
Okay.
Sure,
the first thing, so welcome. I'm so glad that you're able to do this with me.
Absolutely.
Appreciate it. The first thing I want to talk about is the average woman that is, a listener for my station, for instance. There are two things they're concerned about. One is money. Second is trust, because you're a man that I've never met in my life, and I'm entrusting you to make me look like I want to look. And there are so many variables that go along with that. So to meet a doctor for the very first time and say, this is what I want to be, can you do anything with what I am?
Absolutely. I think that really plays into my philosophy as a plastic surgeon. First of all, the first thing I do is listen. I don't know you yet.
Right.
I need to get to know you because what you say and what you mean often are two different things.
That's a good point.
You are showing me your flaws,
which is a hard thing for a woman to do in the first place.
To a strange man in particular, particularly if it's not your face, it's other parts of your body. So that is really critical that I understand where you're coming from, understand what you're trying to achieve and why.
The why would be a big factor.
Well, it is for me because it's not just a factory. It's not just doing a surgery and moving on. For the most part, if I operate on you, you're mine. And I want to keep you. And I'm not going to do something and shove you on and move to the next because that's not my style. So there's a couple of things that I do to ensure that. First and foremost is listen. Then I'm going to ask you some questions. I think it's very important that I know what's going on. In other words, I don't have to know all the intimate details of your life, but if you are 2 days after an emotional crisis, you're really not in a good state of mind to make a decision about undergoing surgery.
I don't think too many doctors would take that time, honestly. I mean, it's not all about the buck for you, is what you're saying. You really do care.
Yes, and my philosophy is that if I take good care of you, the buck follows.
That's true.
Because if I take care of you, you're going to be happy with me. You're going to tell your girlfriends.
Exactly.
Or your sister, or your mother. And they'll take a chance on coming in to see me. And if they meet me and they like what they see, they're going to, so that network goes out. So if you chase the buck, it will end. If you take good care of the people and do good surgery, it'll take care of itself. I don't really have to think about it. I think if you show people that you care about them and you're going to take your time. For example, I won't operate on somebody with one visit.
Well, what do you mean?
A lot of people will go to a physician. They'll come in for a breast augment, facelift, whatever it may be. One visit later, we'll book your surgery next week. That won't work for me because I don't know you yet, and you don't know me yet.
Okay, well that's remarkable. Now, what happens on the second visit?
Well, on the second visit, we confirm everything we talked about on the first visit.
To see if there's no change of mind or hesitancies?
Yes. It sets the patient at ease to get to know me. It's a pretty serious deal when we do surgery. I know all the details, but you may not. We all have the internet now to research, but that's not talking to someone face to face whose hands are going to do the work, who's going to be responsible for you during and after the surgery. So I want you to know, I think of every complication that can happen, every time. It's not routine. I may do 7 of those in one day, but it's one time in your life for you.
I remember a story that you had mentioned to me about 2 sisters that flew in from Nigeria. Is that where they were from?
Right.
I would love for you to share that story with the audience.
Okay, well in essence, actually they were good friends, not sisters.
Oh, that's right.
They were referred to me somehow through a Nigerian connection here in town, another physician and so forth, and they just showed up. from Nigeria, literally after 24 hours of being in the air, and came in and said they wanted certain procedures. And I said, well, that's great, and I'm flattered that you came here for me. And I said, are you in town to shop? And they said, no, we came to have this surgery. And I said, okay, neat, which was, very flattering. And they said, and I said, well, how long are you staying? And they said, well, we're going to have the surgery, we're going to leave in it, a couple days after. And I said, okay, then you'll have to go to somebody else because I won't do it. You've got to stay a couple of weeks at least, because just because the surgery goes fine for the first 24 hours does not mean there can't be problems such as infection or not healing right or what have you for a few days. And if you're in Nigeria, I can't lay my hands on you.
Mhm.
I can't fix you. I can talk to you and I can Skype with you,
Right.
but I can't fix the problem, and you're mine if I operate on you, and I take it very seriously.
What happened?
And they stayed.
Of course they did.
So-
How could you refuse?
Right, so we operated on them a couple days later, and they stayed the 2 weeks, and everything went well, and they were happy, and called me when they got to Nigeria and let me know they got home safely, which was really nice.
I love that. I just love that story. It's not all about the doctor. It's about who you have working with you, too.
Oh, absolutely, I think that's critical.
I would love to know about your staff.
My staff is great. They've all been with me a long time. My youngest employee, not her age, but youngest in the office, is about 6 years. The next two are at about 10, and the last is at about 14 or 15. So,
So they're devoted.
yes, and me to
And
them.
you are devoted to them, that's
Absolutely.
right.
I spend a lot of time with them,
Yeah.
face to face. In my culture, or the office's culture, is taking care of the patient first. Everything else will follow
Mhm.
if you take care of your patients. And that starts from that first phone call. If
That's right.
they're having a bad day, I don't want the person on the other end to know that.
Mhm.
The patient comes first every time. From that first phone call to that first visit until they finally see me, there's a lot of interaction with my staff, and they have to be on their game every day. They have to genuinely care about the practice,
Well, it shows.
which means the people.
Yes, and it shows, because I know when I call, they make me feel like I'm the most important person in the world.
As you are.
We're going to talk about so many more things. We're going to get into the technicalities of things that you do, and maybe women want to talk about liposuction, they want to know things about it, or Botox, fillers. So we're going to try and cover everything in maybe another video.
Okay.
Bring
sounds
them
great.
back.
Sure. Absolutely.
Keep them wanting more.
Okay.
So thank you so much for tuning in and watching and meeting Dr. David Klein. Isn't he a gem? I'm Robin with K104.7.